Okay, so here's what I want to figure out. So when I was going through
Yeah.
your case study and going through everything this morning, there's a couple of things I was concerned about. One of them was, tell me about the temperature differences between your limbs. Because you said one, I can't remember which one was, right hand or left hand is more cold at times, or your leg.
You know, I was thinking, I'm sorry, but it can be osteoarthritis also.
Well, just tell me your symptoms first.
Okay, so symptoms are basically that my main reason is that at night my legs get very cold, my feet get very cold, and so I need many layers of comforters. And it's not the heat per se, but it's just air. That is the problem, you know. Like if you give me an electric blanket and you say, okay, yeah, just have one comforter and on that like have an electric blanket, you know, and you should be good. But that doesn't do the thing. I have to have many layers so that the air doesn't seep into. I know this has been my issue.
Air doesn't seep into it.
My bones kind of as if, you know, this is how I feel.
Okay. Well, when you put blankets on top, does it help you?
Yes, then that's why, because for some reason, I think there's insulation. Yes, there is insulation. And now nothing is getting in from outside. At night, for instance, if I'm sleeping, my bed is like here, and I get out from my left side, and I come back, then my left side would be cold because now air has gotten into my bedding, right?
Okay.
And so my right side would be okay because my right side was covered, right? That area I didn't have to leave from my right side. I left from my left side. I went out, went to the restroom, came back, and then again I picked up my blanket or comforter, and then I, went in the bed, and so that's where then I feel, oh, this area is getting cold, and I need in parts of places I need hot water bottle. So it's not like the whole area is where I need that is feeling cold. It's parts of the areas.
Okay, so it seems more like it's a circulation issue more than anything.
Mm-hmm.
It's just extremely sensitive to temperature change or air if you're not covered.
Yeah, I think you are right partly because I think if I do, like for instance, exercises where I put my legs up and maybe I think that does help.
So it does help?
Yes, stretching does help. Like for instance,
movement does help.
Yes.
Okay.
But I don't know how much it helps. I mean, it's not like it I have ever been at a point where I feel, oh, no, this is great. Now only in summer, now that we are in, coming into summer, and now my layers will begin to come off. So for a few months, and then, yeah.
Okay. How do you associate that with arthritis? Why do you think it's arthritis?
I remember I mentioned to you that I cut my this left thumb.
Okay.
And I had an injury here about 2.5 years ago, December 2019. I had an injury, and when I went to the doctor, I went to the specialist to get it seen, and they did an x-ray, and that's when he said to me that you have a beginning level of osteoarthritis here,
Okay.
in your so that is why I think that it can be, because I do feel like in my ankles and my I feel more cold like in ankles or my knees, or like here the hip, the joint area of here. And so that's what makes me think that maybe then, of course, if it's at one place, there is, yeah. Oh, and also, interestingly, a few years ago, and I have noticed that allergies, when I have more, because it fluctuates, and so I feel cold in here, on my cheeks also. So if I keep these warm, then I don't feel the stiffness, and and my sinuses or whatever this area is more comfortable then.
Okay.
And this started maybe 4 years ago or something like that. And also because I've lost a lot of weight also, and so I don't really have much cushioning in my body too.
So you prefer just to be wrapped up, covered all the time? Comfort-wise?
Not all the time. No, not all the time, but it varies. I think when I am not, like I said again, allergies probably is one of the things that I'm thinking of. That is maybe the reason why my body becomes a lot more sensitive. Like you just said that you were also cold, right? So to a certain degree, yeah, I'm not, like for instance, I'm not very cold here and I'm comfortable. But yes, I am wearing closed-ended shoes, and I am wearing something. I wear 2 layers on my legs. It's the outside pants, and then I have tights always, underneath. So that is something that has changed. I have to have tights underneath, to keep my legs warm. But upper body, no, it's not. Yeah.
Steve, do you ever get any cramping in your legs?
At times, yes, I have gotten before, but now not.
It's not infrequent.
No, not now. But yeah, I would say maybe 3 years ago, 4 years ago, I would get cramping in my lower part of leg, and again, because I have noticed I have taken so many supplements also. That's the thing I have noticed when I just had. I had digestive issues, and I had food sensitivities, and I was aware of that actually. So I would not eat gluten very much. I would not eat. So I've been taking digestive enzymes for I don't know 14 years or maybe longer. And so since I am quite intuitive, about myself, so. If something didn't work, I would say, no, I would not do it. But my problems actually, I told you that when it came to health education, I was nil, And so when I started seeing practitioners and I was at a point of desperation, so then I thought, okay, this person knows what they're doing. So if this person is saying, do this, I'll try this, And then come to find out that some of those things were not what I should have done. But, and I don't know then, what was it that happened that my brain got very inflamed? I'm sure I had brain fog for many years, when I would go to work in the morning, and I know sugar was the reason. I'm learning about all these things, as I eat and I see how it affects my body. And I know, this is what it is, so the cause and effect. And so that's why also, of course, I have improved a lot because now I know what to do, what not to do, But coming back to where we were, and I was saying that, so that's when I started seeing practitioners and they started guiding me. I just did whatever they wanted me to do. And then I think, meanwhile, of course, that Ayurvedic practitioner, she said, oh, you can eat wheat. I mean, whatever. She said, Americans have overrated this thing that, So I started eating wheat, and of course, inflammation was way out of control. My brain was I was totally out. I mean, and I did not know what was going on because I didn't know what causes what and what's going on, and I would just So anyway, so then it was so bad. It was so bad that I had to find naturopathic doctor, Dr. Gela, and she was close to our house. And then she has been practicing for 35 years. And I went to her, and she was very, very, empathy level was really high. She really tried the best. She gave me biocidin formula, but of course biocidin to this day, actually I tried again a month ago, and I am better, but it's not for me, because it gives me brain fog, and it gives me some things there are in it which do not suit me. And but at that time food sensitivities were way, way, way high. And so she tried to help me, and then she said to me, 90% of the people who come, I'm able to help them, but you are one of those 10%. And so then on my own, the thing was, but I was looking for somebody who could say to me, look, I can't do it, but there is this person who can help you, if they're in the industry. But nobody would say anything, and I just had to then find on my own. Actually, she shared with me some information about Dr. Chalkers, about I would have gas, it was on my left side in the colon, and so she thought maybe, I don't remember the word now, but anyway, so she gave me
See, but can I stop you for a second?
Yes, sure.
Do you remember what the initial question was I asked you 4 minutes ago?
So you said, Ziba. Oh, you asked me about the cold, and you asked me, do you feel one side of cold more than the other?
No, I asked you if you have leg cramps.
But first you asked me that, and then you did ask me about leg cramps.
So,
yes,
so this is called timelining. And this is an aspect of focus and attention.
Okay.
Do you have a hard time with focus and attention? Because you went into like a 5-minute, totally off topic with no links to anything we discussed.
I have an issue with that, and I think I've always had that issue, that I go off tangent.
Okay.
So you'll have to keep me.
So it's a aspect of frontal lobe function.
Okay. Okay.
So you said you've always had that?
I think I've always, from always, what I mean by, because I think when I was, maybe somebody said to me, I was sharing something at there were a group of people, and I was sharing something, and I have a friend, actually, she's a professor in pharmacology. So anyway, in that, but it was not pharmacology session, but she said to me, she said, oh, you go off tangent, So it's since then that I have kind of, it has stayed in my mind. And yes, I have tendency that when I start, I just kind of keep on, so whatever it is, yeah.
Okay. That was the first time someone actually told you that? What year was that? Can you remember?
I think that would be about 22 years ago, for sure.
Did anyone ever tell you something like that in your childhood or before that?
No.
Okay. Do you have a hard time with organizing or planning? Is that difficult for you?
No.
You have no problem?
No.
You're on track?
Yeah, organizing, I would rather have somebody in my house come and do things, but my house is pretty organized. I mean, it's not like I don't live like in a cluttered place at all.
Right.
Yeah.
But planning and staying on track, do you have any problems with that?
No, I don't have.
No, think so? Okay.
No.
Okay. So, you had leg cramping.
Yes.
Let's go back to the vascular health. So this is a huge tangent, like that shift. Okay.
Okay.
So that's let's focus on the topic.
Yes.
And your ability to focus on the topic is going to let us know how your frontal lobe is doing. Okay. Do you ever have any swelling in your ankles or legs?
No, I have not experienced swelling in my ankles or legs, but just recently I feel that I sometimes wear on my this left knee a brace, just to keep it warm. For instance, if it's really feeling a little pain, not too much pain that I have to take any pain. No, not at all, but discomfort, I would say. So if I wear a brace, that's one from Kaiser. They're very comfortable. They're not those sports type of braces. And so then I think because of maybe, then I feel maybe I have a little bit of swelling.
Okay.
Just very minor.
Just on your knee, here and there.
Just on the knee, yeah.
Did you have knee? You said you had knee surgery in the past.
I didn't have knee surgery, but I had knee injury.
Knee injury. Okay.
On my left. Yeah.
Okay. Because you said you think you may have had nerve damage. What did you mean by that?
Well, when I say nerve damage, because that area is a little deep now. That's why it's because otherwise, the area is supposed to be just like the whole. This area is all there's. In that area, there is a little groove.
Okay.
Small area.
Okay. Do you ever notice any discoloration or changes in your limbs, like legs, nail beds, like color going from red to white to blue, or any changes like that?
Only yes. I have, and I have noticed that, and I have taken photos of it as well. And my right thumb, I noticed that this nail bed would go, and this is when I was doing the Ayurvedic thing, I noticed that it had become red, this nail bed, and also there would be sometimes a little groove. I don't know if that is connected, but a small kind of groove, on my on the nail. So I was concerned, and I noticed that when my infection would improve or what, I don't know, it would go away, and then it went away, and then it came back, and then now it's been gone for quite some time, a long time actually.
Just the right thumb? Nothing in your legs or anything like that?
No, not in my legs. No.
Okay. So how do you think your circulation's okay, or do you think your circulation, is off?
I think
hands and feet get really cold. You made some notes that your hands and feet get cold.
Yes.
How bad does it get?
Yes, my hands and feet get very cold actually in winter. When I go for a walk in San Diego here, I wear gloves,
Yeah.
And then actually, when I was in Montreal, when I was 29, because this is now you're talking about cold, right? So that's why
Circulation, yeah.
Circulation, yes. So I'm saying that I know I had because there how cold it is and it snows and all that. So I had started getting achy. My joints became achy, and I think now the cold part. So when it's cold, then again my joints also get a little achy. But that has improved actually. This has improved, but cold, yes, I still have issues with.
Okay. So you think your circulation's not the best?
I don't think so. But my doctor checked, and she said that your circulation is fine.
And what do you mean they checked? What does that mean?
I think she did some. See, I forget also that she did a this is recently at Sharp. I think she has some device, and she just kind of checked like that. Not that I went through a scanning or something like that.
Okay. All right. So one of my concerns was just if you had any kind of early signs of peripheral vascular disease. Doesn't seem like the symptoms. We'll have to do an exam and see what's going on with that. That was my biggest concern. That's still my biggest concern. We want to rule that out. So we'll have to look into the exam. Usually with like peripheral vascular disease, when the blood vessels start to have atherosclerosis, meaning they start to get hard and thick, then what'll happen is people have color changes in their hands. The cuts won't heal. they'll
like this happened like
this happened
for
to
a
them.
long
Yeah.
time.
You might have just really bad circulation, but not necessarily peripheral arterial disease. That's what it's sounding more. Because when you read your case review, it's not really clear. But now that I'm talking to you, it seems like it's maybe just really bad circulation. Okay, you could have some, arthritis throughout the body. Have you had any besides that little X-ray of your thumb? Anything else? Have you ever X-rayed your knee or other joints, or just that thumb? And they said you had some early degeneration there.
Of course, this is many years ago, maybe about, I would say 7-8 years ago, because I would have pain in my knees, and that is now I know the grains, if you avoid grains, then I've noticed that you don't have pain.
That's for you, yeah. You've noticed that for yourself.
Yes, I've noticed that for myself, because whatever I'm talking, I am the case. I have no other knowledge, So they got a test done, through scanning, maybe MRI or whatever. I've forgotten because it's been so long. But the result was that no, I don't have arthritis and I don't.
But how long ago was that?
Maybe 8 years ago, or
yeah, it might be too long. Yeah.
But now I have noticed that if I don't eat grains, if I eat more like lentils, not lentils, but you know what I'm saying, pulses or rice or grains, then if I eat too much of that does affect the pain.
The pain.
Yes.
And just your hands or everywhere? Your knees and hands?
No, I think knees as well as
Okay.
as well as hands or elbow. My elbow is also beginning to feel at night very cold.
You use the word cold, but the cold may just, and it seems like when you use the word cold, it's specific to your joints more so than your tissues. Is that right?
Yes.
Okay,
yes.
So that sounds more like you're saying, more maybe arthritis-like.
Yeah.
Because cold is,
but I feel cold then in my joints, that's the...
Right, I understand.
That is what it is, people feel.
Is there any family history of rheumatoid arthritis that you're aware of?
No.
Your parents didn't have any disfigured fingers or fusion of their hands or things like that?
No, but my aunt, one of my mother's sister, she has had stroke, and after the stroke,
she's spastic, yeah.
Yeah, but she has been living, and she lives in a village. I'm surprised. She's been living well in her 90s now.
Okay. So there's a possibility you may have early patterns of rheumatoid arthritis, like what you're explaining as cold.
Is it rheumatoid or osteo?
It's not going to be osteo. Osteo is osteoarthritis happens when you have repetitive injury to one joint. Like if you constantly if you injured your elbow and you keep using it uninjured, and then that joint itself degenerates. It's mechanical. It's from mechanical trauma that causes osteoarthritis.
Because that doctor, especially, he was at Sharp, and this is not long ago, he especially said, no, this is not rheumatoid arthritis. So what is the other?
Osteoarthritis.
Yeah.
Yeah, you may have osteoarthritis in their finger at that time.
Okay.
But the symptoms you're explaining, where it's like your knees and your elbows all throughout, that's rheumatoid.
Okay.
That's systemic. So the key difference is when it's all your joints, and foods trigger all your joints to hurt.
Yeah. Okay.
Yeah.
Okay.
Now, if you were telling me you were a boxer for 20 years, and when you eat brains or joints, your wrist hurts from when you were boxing, it could be osteoarthritis.
Okay.
If you don't have any mechanical trauma or repetitive injury and your joints just hurt throughout your body,
yeah,
that could be a red flag for rheumatoid. And the sensations you're writing as cold, because I'm trying to interpret what you're feeling with what you're writing to what we need to investigate. Right?
Yeah.
So it sounds like that's more like a rheumatoid issue.
Okay.
And you notice wheat and grains make an issue. What about things like nightshades, like tomatoes, potatoes, lectins, things like that? Do they bother you?
Yeah, I mean tomatoes. I don't eat tomato. Like last night, I had, for instance, a soup with. It had lots of tomatoes. I got it from Jimbo's, salmon, and lots of great vegetables. But I had it just without the liquid, and I took out the tomatoes also.
Yeah. So
there was only just salmon and some good vegetables in there, and I ate that. But I felt even that much, it does. My gut does feel.
What about your joints?
My joints were okay, no.
So the only foods you see impact your joints are wheat And grains?
Yeah, but I have not eaten meat in years.
I understand, but besides
But
that.
I from what I remember, yes.
So right now, if I give you a bunch of chickpeas and lentils and tomato and all that, you ate it, you wouldn't notice a thing in your joints.
Not right away, but maybe it'll take me, I don't know, 24 hours or maybe to feel that.
But have you noticed that relationship?
Yes, I have noticed. But for tomatoes, I don't know about joint. Tomatoes is more histamine,
Well,
Tomatoes.
hold on.
Yeah.
So there's a lot of associations you're making on your report
Yeah.
and your history.
Yeah,
which
sorry,
may
yeah.
not be accurate.
Okay.
But they are, in some ways, important to know. But let's make sure.
Yeah.
So you took ashwagandha and you didn't feel well, right? Which is nightshade.
Yeah.
Did that cause any joint pain for you?
At that time, it was more like my brain, I think I was focused on rather
Your
than...
brain, yeah.
Yeah, at that time, it was just...
Okay.
Yeah.
The reason I ask is because when you see joint pain, you see joint pain triggered by foods, and especially if you see joint pain triggered by lectins, like lectins would be like seeds, nuts, tomatoes, eggplants. The nightshade family will all have lectins in there as well.
I see,
That
I see.
more strongly suggests that it's more like rheumatoid, because those dietary patterns cause it or trigger it for most people. There's an overlap of the immune response. It's called the agglutination that takes place.
Okay.
So I'm going to make some, like as we talk and go through history, I probably want to measure something called rheumatoid factor, which will be a marker that checks to see if you have early rheumatoid lab markers.
Okay.
And then we'll probably want to do an autoimmunity marker to check your joints, see if you have any kind of underlying joint autoimmunity. And that'll help us understand what's happening with the big picture of what's going on.
So underlying joint autoimmunity is
Like
different
rheumatoid.
than rheumatoid arthritis. Is different than rheumatoid arthritis? Or it is rheumatoid?
It is rheumatoid arthritis.
Oh,
So you could have like rheumatoid as a primary condition, or you could have like rheumatoid because you have lupus or other connective tissue diseases. So rheumatoid is one specific joint disease, but then there's all different types of connective tissue diseases that can really impact your joints well. So
Okay.
we can do a panel to see if you have differentiate between those.
Oh, okay.
Okay,
Okay.
it's something that will help us understand and predict what's going on. Plus the sensation of cold you're having, we still have to.
Even
figure
now,
out.
right now, I'm feeling cold here.
In your joints.
Yes, I can sense like. Yeah.
Is it the same in both hands or more in one hand?
No, right side is feeling more right now.
And it can switch to the left side feeling more later, or
I don't, but I know.
let me feel the temperature of your hands.
I'm always.
Yeah, it's hard to tell. I need to use equipment. Okay.
Mm.
All right, we'll get to that more, but I think the heat. You also write in your case review, like your third chief complaint, which relates to all the things we're talking about, is heat, cold imbalance. Cold is major issue. Is that a reference to this?
Yes.
Not actual temperature of your room or where you walk into your house, but the temperature, cold sensation you're feeling, which is actually appears to be your joints.
Yeah, I mean, for instance, when we entered the room, this room is colder than that room, right?
Yeah.
So that's anybody would feel, but I don't know in which sense.
Well, you wrote. Help me understand. You wrote chief complaint. You put heat, cold imbalance. Cold is the major issue.
Yes.
What does that mean?
So this is what I'm saying. Like, because I feel so cold, I have to always make sure that I wear 2 layers of tights, even if it's.
So that's like body regulation of temperature, and then you also
Yes.
use the word cold when you talk about your joints.
Yeah.
So this is I'm trying to translate.
Yeah, I know, because you are looking at it maybe from a doctor's perspective, your terminology, and I'm using just a general
But we want
terminology.
to make sure we get a right workup, right test,
Yes,
right
yes,
diagnosis.
yes,
So
yes.
we haven't figured out what these things mean.
Yeah.
So that's what I'm trying to understand for you.
So
you have both temperature regulation issues where you have to put on clothes.
Yes,
And
yes.
like if you sleep on one side of the bed or another, you have to cover yourself up because you
Yes.
feel sensitive to temperature changes.
Yes.
But we use the word cold in reference to how your joints feel.
Okay.
Like right now, you said your joints feel a little cold.
Yeah, so that is like temperature. Is that how you would say it? So
You just say you just feel some things in your joints or joint change or something. But you're using the word cold in 2 different contexts. One for joint and one for actual room temperature, it seems like.
No, not room temperature. It's just doesn't matter.
Or air,
Somebody else
or-
would come in that same room and they would not feel what I'm feeling, right?
Well, they may not need to wear 2 layers of clothes.
Yeah.
And they may not, like, they might get out of bed and use the restroom and not feel like one side of their body is really cold now.
Exactly.
That's thermoregulation.
Yeah.
So
Yeah.
now you have some patterns of thyroid that could be causing that. Some metabolic issues can cause that. That's different than, let's say, your joint symptoms. That could be more of a autoimmunity that could be causing that. So those are so we're trying to figure out the big picture. So it sounds like you have both, okay? And as I try to interpret the symptoms you're having to what mechanisms may be, it's clear to me now that it's both thermoregulation, circulation even maybe,
Yeah.
and then also maybe some arthritis, rheumatoid arthritis, maybe, or systemic joint symptoms. Does that make sense?
Yeah, I think so.
You agree
yeah.
with that?
Yeah.
Okay.
Yeah.
Now, you also write here, like, your number one chief complaint is gut issues, indigestion, histamine intolerances. Now, tell me what that means without using anyone else's diagnosis.
Okay.
I don't want to know. I don't care about anyone else's diagnosis.
Yeah.
Let's assume everyone's wrong. We're starting all over.
Yeah.
What are your actual gut symptoms?
So, actual gut symptoms were like,
Right now.
Oh, right now. Okay. Yeah. That I cannot eat tomatoes. I cannot eat nuts. I cannot. Histamine. So nuts, tomatoes, eggplant. I have not eaten in a long time.
Okay.
So that's like nightshades, I'm talking about.
Yeah.
So I cannot have wheat. I don't eat, and my thing is I am concerned about my weight loss. I mean, I am stable now for 2-3 years now.
Yeah. I mean, you're definitely underweight. We'll check your BMI and everything, but
Yes.
you're for sure underweight.
Yes, so that is my concern because I have so many things that I can't eat. All I can eat is and thankfully, not long ago, I started eating fish also because.
Let me just.
So that is my.
Let me help me because I want to understand. So when we say gut issues, you're saying you can't eat tomato, nuts, eggplants, wheat. So you're referring gut issues to foods if you eat, you get symptoms. Is that
Yes.
right? And what are the symptoms you get?
So I would get like. Okay, so symptoms are. One is I'll start with. For instance, it would be gas and bloating.
Okay, gas and bloating. Yeah.
And constipation.
Okay.
Now let me say that because I take supplements
Yes,
also.
you take a lot of supplements.
Yes, and when I'm referring to these supplements is the antimicrobials. So when I am taking those, then they are under control, right? This gas and bloating, it would improve. But then when I stop taking, so that's just one part of what my gut issues is, that when I stop taking the antimicrobials, for 2-3 weeks I'm fine, I'm okay, and then I start getting these symptoms again. Now
Gas and bloating. When you say so, everything gut is gas and bloating.
Gas, bloating, constipation.
And constipation. Okay.
Gas, bloating, constipation.
Okay.
And so that's indigestion basically. Although I do take always enzymes, digestive enzymes. So, or I would feel acidity also at times. This is
You
not
mean like
my.
you mean reflux?
Yes.
Or burning in your stomach?
Not burning in my stomach.
Up your esophagus?
Yes.
Okay.
Yes.
And how often do you have reflux symptoms?
It's not severe. It was very severe very, very long ago, but now it's not severe. So I will take right away. I'll take, for instance, if I have eaten food and I'm feeling a little bit, and so I will take. I have made a combination of turmeric, a little, let's say 20% turmeric, and the rest is licorice powder. So I'll just take that a little, just 1/8 of a teaspoon or something like that, and that helps.
But how often do you get reflux?
I would say maybe I would say, let's say on average, out of 7 days, maybe 5 days, you know.
Okay,
or 4
so let me go
days.
back. Your main GI symptoms are gas, bloating, constipation. You notice the relationship between wheat, nuts, tomatoes, eggplants, basically nightshades, right?
Yeah, and of course grains.
Yeah,
you know.
all grains, yeah?
Yeah.
Okay. And what about nuts and seeds?
Yeah, those I can't really like. I'll have like maybe 1 or 2 almonds, and that's about it. I can't eat.
What about milk, dairy?
Oh, not at all. Oh, that is
Okay.
big inflammation.
So basically, all the foods that are on the autoimmune paleo diet, you can't eat. So if you follow the autoimmune paleo diet guidelines, no grains, no dairy, no gluten, no seeds, nightshades, lectins, you feel better. So,
Yes.
or to say it differently, if you follow the autoimmune paleo diet, you notice a change in your gas, bloating, constipation. And if you don't follow those guidelines, then you get more gas, bloating, and constipation, right?
More, yeah.
But you have gas and bloating all the time, no matter, even if your diet's clean.
No, not all the time. But like I said, I'm good if I am on antimicrobial, and again depending on also antimicrobial. Some are more effective than others, but then I take a round of it, and then I'm okay for let's say 3 weeks or 4 weeks, and then for some reason it comes back. Maybe I have eaten something, which was not right, because I do eat a little bit of rice every day, and I do eat sometimes a little bit of there's a specific pulse. I don't know, in Indian cuisine it's a lot, and it's very good for blood sugar level, but I do kind of soak it all night, and then I cook it, so I don't know how much lectins there are in it, but a little bit of that sometimes, I have that, but that's but other than that, basically just vegetables and meat. That's what I eat.
So why do you eat that? If
Oh.
you might be poor, why do you eat that?
Because I don't want to lose more weight. I'm just trying to stabilize
it
my
helps you stay your
weight.
calorie. Okay.
I
Are you on
Yeah.
a vegetarian diet, or do you eat
No,
animal or
I eat meat. I have to.
No problem.
Yeah. No,
Okay.
not a problem at all with meat or.
Okay.
Yeah.
So right now, and by the way, let me ask you another question. Then I want to go back to this. You also went on a FODMAP diet that you said helped you, right?
Yeah.
What kind of? It just got rid of your gas and bloating when you followed those restrictions.
The reason what happened was when I was with Dr. Gela, that was in 2017 probably, 2018, yeah, with Dr. Gela, and she was not well versed in nutrition, and she was not able to fine tune. See, the thing what happened was, I'm from Pakistan.
Yeah.
And what I have grown up eating has lots of spices,
Yeah.
and not necessarily that I was eating, what I was eating was high in chilies. We don't put that much chili, but still, that food was very spicy for me, and I could not tolerate it. Now I had to make a shift, and I had to make a shift from that food to the other food, which I have not grown up cooking. I am not, I'm not that comfortable. I mean, I know, but I knew that my body liked it, but I didn't really. So then the food that my body liked was no spices. But then she, like, you read, sweet potato is superfood, and this and that, and it's like, okay, fine, because I don't know anything better, so I'm just cooking it and I'm eating it, and oh my goodness, that is high FODMAP. I did not know that, and that made me worse.
Okay.
And so that was another thing. After Ayurveda, now this thing, and then Ayurvedic practitioner said to me, eat, have yakni, which is bone broth, right? And I'm cooking it for a long time, and I'm working so hard and doing all this, come to realize that is making me worse. And Dr. Gela could not help me with that either.
And how did you notice it was making you worse? When you stopped, you had symptoms change?
Yes, when Melissa came, and Melissa said to me, "You're eating bone broth, she said, you should not, because she's a nutritionist, and she has that background, and she said, no, that makes it worse. And of course, when I stopped, and it improved.
What improved?
My symptoms improved, which was like brain
symptoms?
fog, or I am feeling that anxiety, or now it's been a few years, but it was, my mind would be
Because there's a lot of theories of
foggy.
there's a lot of theories of nutrition, and people say things, and people believe things, and then there's actual clinical response. You actually felt there was a real significant clinical response.
Oh yes,
Okay.
for me, for sure.
Okay.
And sweet potatoes, I stopped eating sweet potatoes because there was a lot of starch. Starch does not.
So starch and sugars make you bloated, distended,
Yes.
and you have to take antimicrobial all the time.
Yes.
Okay, so that's like the classical SIBO.
Yes.
And then you said you watched the gut health puzzle program that I put together, and then you started to follow the SIBO protocol supplement wise. Did that make a
Yes,
difference?
but
for
that
you?
has supplements. It doesn't have antimicrobials.
Right.
Yeah. Yeah.
But that did
yeah.
make it. That did. Do you notice the change with that? What did you notice?
Yes, because I was so before, prior to when I was with Dr. Gela, I would always look for myself on my own also for supplements and stuff, because naturally when I'm not getting better, I'm doing my own research also. And so I came across Dr. Amy Myers, and I got the gut revival,
and that helped you.
It helped me, but it didn't completely help me.
What does it mean? Did it completely help you?
Because it has the it's I know what it is, and it's Katira gum,
Yeah.
And that is high FOD. Yeah. So it helped me in the beginning, and it helped with my stool, and the stool formation became improved, and I was very happy. But then in the long run, Dr. Jockers also has the same supplement with a little bit of variation. But then that did not. I was not really. It was not stabilizing me. I mean, I was better, but of course I couldn't tell what is doing what. But then I took yours. Yours does not have.
Yeah, it's made for SIBO. Yeah.
See, that is where the difference is, because your protocol does not have things that it should not, whereas the others have fillers, and they do claim that you can use it for SIBO and you can use it for that. So
yeah, it's not. Yeah. Okay. So when you were saying you felt better, that was in relation to bloating and constipation. Okay. So I think I'm starting to understand. So your gut issues and indigestion, you're right, histamine intolerance. That's basically your gut having symptoms when you eat foods, and basically the foods are grains, nightshades, wheat, right, milk,
starches.
Yeah. So it sounds like basically overlap of autoimmune paleo like restrictions and FODMAP, like right. Mm-hmm. So okay. Now, when you see those patterns and those symptoms, it's pretty clear. Like that's what's going on, and you know what diet works for you, right? If you avoid those foods, you feel better. Mm-hmm. So when you say gut issues, are you referring to your gut issues or like the inability to eat those foods, to have bloating and constipation, digestion? If you eat a clean diet, would all those symptoms change? Except there's times where you have to stay consistently on antimicrobials.
Yeah. So that's yes.
So basically what you're saying is classical small intestine bacterial overgrowth, but it's also autoimmunity like type patterns. Because those are dietary. So when you look at like bloating, acid distension, and things that aggravate your gut, the key feature of FODMAPs is that monosaccharides, fructooligosaccharides, right, sugars and starches, they're really what cause symptoms, and that's totally different than dietary proteins. Dietary proteins are like wheat protein, milk protein, grain protein, nightshade protein. Those are what you see with autoimmunity. So if we were to kind of look at what your triggers are, there could be an underlying gastrointestinal autoimmunity, and that may be reason why you have SIBO. So we want to check for intestinal autoimmunity with you.
Okay.
See if you have any intestinal autoimmune markers. You haven't had that done?
Yes.
Because it's very clear you have SIBO. Then the question is, why do you have SIBO?
Yes.
And if you have intestinal autoimmunity, then the inflammation can impair and destroy the nerve plexus in the gut, and then you get that whole SIBO pattern.
Yes.
Okay.
Yes.
So we want to screen for that. There's markers associated with Crohn's disease, ulcerative colitis, that can show those patterns. Okay.
Yeah.
And then.
But then I have said in there, maybe you will get to that. So what helped me was a supplement that I got from Pakistan, from these herbal specialists, and that really helped with, because when I would go in at night, my upper torso would just heat up, and if I have not gone to bathroom one day,
your upper torso would heat up. What does that mean?
So when I say heat up, is that I feel so hot. Now I didn't say that my upper torso. I'm just saying my legs are cold, right? But I did not say that I didn't complain about my torso, like my upper body. So that's what I mean by upper torso. So because I think so. When I would not go to bathroom, I would not go regularly. If I didn't go even one day, at night, my body would just heat up so much when I'm in bed, sleeping, and I had to take off. So it's like now my legs are very cold and my torso is so warm and hot. But now I don't have that problem because I took those supplements.
Like hot flashes, menopause, no?
No.
You're having, okay.
No, because his thing was that it is.
This is recent or years back?
I now I have not been taking his supplement like the way sometimes I take. These are just peppers, and I mean this is just very benign, whatever it was, and it was just to improve inflammation and yes.
All right, let me tell you what worries me about working together.
Yeah.
You have so many associations, so many things that you hold so dear to be true, and they're, I'm not sure if they're accurate or not accurate. I know, but there's a point where when we try to diagnose you, we have to try one variable at a time and try different things and have you stick with it. Can you do that?
Yeah, no, the thing is that I'm just saying to you what my experience has been and what has helped me.
I know that. But I'm kind of, I guess, reading through more of it.
Yeah.
You're saying.
Yeah.
No?
Yeah.
Okay.
Yeah. No.
Okay. So right now, the gut issues is pretty much basically SIBO, and food sensitivities.
I agree with you.
Okay, so that's what that is. Okay.
Yes.
And then heat imbalance, I think we figured out somewhat, but now you're adding in the hot torso, which is totally different.
But now I'm okay, like I said. And now I don't have that.
How long have you not had it?
I would say maybe 4, 5, 6 months. It has improved a lot, where before, in summer, I could not even go out in sun at all. I would feel.
So thermoregulation goes back to thermoregulation. Okay. Now listen, your thyroid panel has been off. Have you ever been on thyroid hormones? You're not taking them.
Yeah, that's another story as well. I had to ask Dr. Gela, yes, I had to ask her, please, because I had read Dr. Amy Meyer's book also, like on thyroid, and I said, please test me for thyroid. And so she did the test, and my T3 levels were low.
Yeah, you have a low T3.
And she gave me this, whatever the supplement was. I don't know what the reason was, but anyway, that didn't help because I used to feel very, very tired and lethargic. And so that didn't work. Then Melissa came in on board and she changed the supplement. This is Dr. Jocker's Thyroid Strong that I take now currently. And she did kind of mention, see, that was the thing with my journey, is nobody was, and that is why I came to you, because nobody, these are like general, just like I'm talking to you and you say these are my concern, because my experience has been generalized kind of, and so my education has been very, very nothing,
Yeah.
And so my whole, this language is also very generalized because that's all I know. And so then she changed she gave me Thyroid Strong, and then she did mention selenium, but then I didn't focus on it, and then later on, just 2, 3, 4 months ago, maybe 5 months ago, I added more selenium to it, and wow, my exhaustion was gone. I was not feeling tired. It was the selenium, but I have not tested thyroid again for my low T3. But
low selenium has been associated with not converting T4 to T3.
Yeah,
but that still may be there. we need to check.
Yeah.
So you definitely, when you say you have intolerances like to cold, intolerances to heat, that's basically the classification of thermoregulation, right? Your body regulating temperature.
Yeah.
Because and when that's off, then you become extremely sensitive to hot day, warm day. We're extremely sensitive to something that's cold, like air or something. So
yeah,
I mean that's a classical thyroid symptom. And your labs, like you've never had a normal. Every time you've had your thyroid check, it's never been normal. So I don't know if any of the protocols actually did work for you, other than you noticed selenium made you feel better. But your T3 has never been normal for any of the tests you sent me.
Yeah, you're right.
But also, to be fair, one's 2021, 2021. And then on the last one, you showed actually some hypothyroidism. Your TSH was actually on the higher range. It's outside the lab range.
Yeah.
So you're hypothyroid, but nothing done for that, right? Okay.
Nothing done that was significant enough to.
So we have to do like a good thyroid panel and make sure everything's okay. That you can bring T4 to T3, free T3, reverse T3, TSH. We gotta get a big marker there.
Yeah.
Now, if you are hypothyroid, an actual true hypothyroid, like thyroid replacement could make a huge impact on your health. But let's see what's showing up. Okay. But you've never in your medical history ever gone on thyroid hormones, right?
Thyroid hormones? What do you mean by when you say
like prescription thyroid hormones you would get
from
at the pharmacy?
Doctor?
Yeah.
No, actually, I did get once long ago. I remember maybe 5 years ago. I think, or 7, no, not 5 now, 7, 8 years ago maybe. Thyroid medicine, but that was like my body just totally rejected it, and I was feeling so bad, so I stopped it. So, but my TSH has always.
Do you remember what the name of the thyroid medicine was?
No, I'm sorry, I don't. It was from Kaiser.
So they diagnosed you back then, because there's no way in the world Kaiser is going to give you thyroid hormones, thyroid medicine, unless you're actually hypothyroid. There's no way an HMO will ever do that.
Yeah, I know what you're saying, and but then after that, whenever my TSH was done, it was fine because that's kind of a normal every year. 2
results you sent me. One was borderline normal, right on the close end, and the other one was out of range. And then both of them had T3 conversion issues.
Yeah, but I just, you saw from Sharp, right? My test done for TSH, and they say this is good. I don't have a problem. See, this is all the functional medicine. Whatever has helped me is through functional medicine.
I know.
Nothing through allopathic doctors. So that's why I'm sorry, but I have developed some level of not. I don't have comfort level with the doctors,
Yeah, this is everyone ends up with their own biases through the experiences they have, and it's your world. It's what you've experienced.
That's
We just don't want to neglect anything that's significant, because if you truly are hypothyroid, like that could make a huge leap in how you feel and how you function.
Yeah.
And then maybe it's not even hypothyroid; it's just conversion issues. That's a problem, but maybe it's both.
Yeah.
And maybe the type of replacement you were taking had fillers you were reacting to, so it made you worse. They can't handle wheat filler, you can't handle grain filler. They use modified food starch and like basic Synthroid. So if you went to HMO model and they gave you thyroid medicine, you had a high TSH, and they gave you a synthetic T4. That's the way it works in the HMO model. So you didn't react well to that. Okay. There's a lot here, Ziva.
There's a lot here, huh? Yeah, I know. It doesn't seem that much, but then there is a lot here because my body is weak.
But at the end of the day, now we know you have some potential joint autoimmunity. We know you got some thermoregulation issues, the history of Hashimoto's. We know that when you really talk about your GI symptoms, there's a red flag for both FODMAP and intestinal autoimmunity. Intestinal autoimmunity may be causing your need to be on a FODMAP, low carbohydrate sugar diet.
But you brought up the word Hashimoto, but then my TPO
you're negative. It's always negative.
Yeah, so that I don't have Hashimoto's. Yeah,
that's possible. There's the thing is there is a percentage of people that will only show up with biopsy that still have Hashimoto's. We don't know. You could also have antibodies that are really low, like B cell counts, anti-immunoglobulins that are so low you're not testing positive. So we have to consider that too. So we're going to probably want to check a total immunoglobulin panel on you. Okay.
Okay. So the Mega IgG 2000 that I take, it has immunoglobulins.
Yeah, it's different. Now, since you brought that up, let's talk about your supplements. You're taking almost 30 supplements.
Yeah, because they're like vitamin D and then zinc separate, and right because of that or whatever.
Yeah. I mean, there's
Yeah.
at least 30 different things. Because
Yeah,
in some of these lines, you put more than one.
Yeah, you're
CBD,
right. Yeah.
That's a lot.
I know. That's
What would happen tomorrow if you stopped all of it?
What happens if? Well, I've noticed Mega IgG 2000. I kind of reduced it before these allergies. Rather than 4, I was just taking 2 caps, and then my allergies were like recently, like really bad. So I said, I increased it to 4, and yes, sure enough, my allergies improved. In addition, then I had to take some supplement for allergies, but it does help me with my immunity.
Okay, I'm not. But what would happen if you stopped everything?
I'm a little scared.
You'd be nervous.
Yes, I of course. Yes,
Okay.
yes.
If you had to pick only a few, is there certain ones you would pick? Which ones? Like if, let's say, you were having to carry a bag and you could only carry certain supplements, you were traveling or something.
My antimicrobials.
Your antimicrobials, and let's see. So what would that be?
So candibactin BR. That is
Make a list of your must-haves.
my favorite.
Yeah.
Supplements.
That also tells us what is your mechanism, what's helping you. Okay, so is it which one?
Candibactin BR. I don't know where it is. Somewhere in the line. I don't know. So where I think where you would see biocidin, maybe that's right above that would be.
Oh, you put GI detox. You put biocidin twice.
Because
here it's Candidibactin.
Yes.
The Proflora.
I don't know. Alternate with. No, I think that's not how. It's just Candibactin BR.
Okay. And that's like an antimicrobial.
Yes.
From a nutrition company.
Yes.
Okay. What else?
And I would take enzymes for sure.
Well, okay, digestive enzymes for sure. Yeah.
Yes. I would take thyroid strong or something for thyroid with selenium for sure.
Okay. Because you noticed a big difference with that.
Yes.
Okay.
Yes. I would take Mega IgG 2000.
Okay.
I would take vitamin D. I think quercetin, vitamin C, but I can't really. Maybe for a few days, if I'm off of it, I would feel the difference.
Okay.
I would take this 21 Triphala motility activator down
You notice a
below.
difference with that?
Yes, for my constipation. I don't have constipation, but I think it's more of motility.
Okay.
And then, of course, my sleep.
Melatonin at night.
1 mg only I take melatonin. 1 mg and brain calm, magnesium and L-theanine.
Altogether.
No, they are separate because I didn't
So
come
it's
across a
melatonin,
supplement that had everything in
brain
it.
calm, magnesium, and L-theanine.
Yes.
That's your cocktail at night.
Yes.
You need to do that to sleep.
Yes, to calm myself and yeah.
Okay. Anything else?
So sometimes I take like CBD oil, not every day, but like for instance, Serifos I take, like that also not every day, dependent on, if I have to rush for something or, then I take a capsule of Serifos, and that helps. That does work really well.
Okay.
So I would think if I eat then fish, then I don't take fish oil, and maybe I don't know. Depending on again, magnesium. Magnesium is good. Calcium. See, I have to take calcium because I have osteoporosis, and so beginning level, and it has stopped there. See, so I have to.
So this is a list of intention, meaning you notice these things help you. It's not a list of confusion and just trying to take things to feel better. Like each of these things help you.
Yeah. Before, when I was not going through the doctors or whatever, I was just taking things, on my own. But this is basically, but not the top one. No, I'll take that out. I started this after a long time, tried it again, and that doesn't work.
Okay.
See, this is in response to the blood work that was done for me, and it's like, okay, where?
Let's just assume everything you've had done is not on the player anymore. Like as far as labs and people have assumed you need to take or stuff. But your personal experience is more important than anyone's opinion.
Yes.
With supplements. That's what I would really like to know.
Oh, okay. So yeah, magnesium works really well. So I think vitamin D, I don't know how it affects me, but I know that when I look at the blood work, then I need it. But
and what are you trying to accomplish working together? You want me to help you figure out the mechanisms that are involved?
The reason why I am here with you is because I want to know what's really going on in the body. And like you said, that yes, you have SIBO, but then what are the underlying mechanisms? What has really caused it? I just want to know.
Yeah, and we may not be able to find it, but we'll have to look. We'll look for some things that we may not find.
Yeah.
Okay.
Yeah.
So you want to like try to figure out, because you put in on a lot of your comments working with practitioners, they help me with somewhat, but they didn't find the root cause. They didn't find the root cause. So you're trying to really find the mechanism.
I want to find that
so it's
scientifically.
more diagnosis. You want to understand the diagnostic part of this, because you're doing a really thorough intervention. Even if you had intestinal autoimmunity or SIBO, you're taking all the things you would normally take for it.
Yeah.
You're already there. Like it's not like we're going to come up with a new list of supplements and go, okay, you were all wrong. Right? You're aware of that.
Yeah, because I have improved. I mean, I know that is why I have.
I know.
But I don't feel 100% that somebody says, you know what? Because like even Melissa said to me, I wish you could go to somebody and somebody could see you actually. You know.
Right, yeah,
so I really appreciate these functional medicine doctors or practitioners. They were really. They wanted the best for me actually, and I really truly appreciate that. So that's why I am here with you.
No, I understand. Okay. All right. So if I kind of look at your case review and like your chief complaints, so my summary so far is like your gut issues sound like they're autoimmune because you have an autoimmune paleo diet trigger. People have autoimmunity. They can't handle grains, wheat, soy. Grains, milk, soy, sometimes corn. Just nightshades, lectins. Like that doesn't happen with SIBO. That happens with autoimmunity.
Okay.
And then you also have the SIBO on top. So that's like the overlap. So again, I think you have some. So we have to rule intestinal autoimmunity out. We have to rule out joint autoimmunity, right? Your nutraceutical interventions may not change much when we do this, because you're already taking a lot of things that are like key things to do when you have these patterns you have. So even if we find out you have like intestinal autoimmunity, it's probably a good idea for you to stay on D. It's probably a good idea to make sure your barriers are healthy. It's probably a good idea to take enzymes. Like all these things are probably appropriate. So I think that's going to be more diagnostic part of it. The joint symptoms you're having, we're going to make sure you don't have RA and some of those rheumatoid factor markers and any kind of connective tissue disease. And then the circulation, vascular flow, thermoregulation, that might all just be thyroid. We don't know. But we'll do a thorough exam with you. Now, the other key thing is you're underweight.
Yeah.
When did you really start becoming? Were you underweight your whole life, or is it a recent thing? Or
no, my family has never been really. I mean, we have always been very slim, kind of,
body type. Yeah.
Both my parents were. Only my grandmother from my father's side was a little bit, but not really even that was. And so my grandparents on both sides, slim, and so I think it can be genetically. I am a petite, thin person.
But for your own body weight over the years, have you noticed a difference?
But yes, when after 2017, when I started again Ayurvedic, I don't know what was the reason. That's what I have been curious, and but maybe so in my language, the way I see it is that it was a lot of inflammation that had developed in the body, and so when I started. When that inflammation was gone, then all that excess weight was gone with it, because inflammation was probably because I'm eating grains or whatever, and so that's why I have that fluffiness, but that was not real. And so, but this being 93 pounds, 94 pounds is not for my weight, for my, and my age, this is not right. I have like my.
So how many years have you been under your normal weight?
4 or 5 years.
4 or 5 years now.
5 years now, yeah.
And is it because when you started to cut out all the grains and things, you lost weight?
I think so. That's all I can think of, because there's nothing else that I've done. I think in 2018 I was 103.
So go over your daily diet with me. Like when you wake up, what you eat.
Yeah.
And go through like a timeline.
Yeah.
When and what you eat.
Yeah.
So what time do you wake up?
Well, now that I've started working, so I wake up early.
What does that mean?
Today, like for instance, I woke up around 5 o'clock because I do pray in the morning.
Okay.
So then I went back to bed, but I couldn't sleep. So.
But just a normal day. Give me some, like, I wake up between 5 and 7. I eat that. So what do you do?
Yeah, 5 and 7 I wake up.
Okay.
Yeah.
And then what's the first thing you eat?
So and my breakfast has been pretty standard actually.
Okay.
I have not been able to bring much variation because it is quite. There is a lot of variation in there. I eat. I eat one fried egg.
Okay.
And I steam vegetables.
Okay.
And those vegetables are generally 4 or 5 different types of, basically the same vegetables actually,
okay.
with lots of herbs in it,
Okay.
lots of different herbs.
Okay.
Not spicy, but herbs, and with a little bit of olive oil and then steamed. And so then what I do is I make like 3 batches of it, and I freeze 2, and then I kind of have one out, and then I have portion of that steamed veggies, 4 or 5 different types of veggies, and then 1 egg, and then I make my own kind of bread, or you can call it crackers or whatever, and it's made up of coconut flour. It has gram flour, gram flour, the chickpeas flour. It's from that. A little bit of, so I would say maybe, let's say 50% or maybe 60% is coconut flour, maybe 30% is the gram flour, and maybe 20% is cassava flour, and I add lots of herbs to it, and ginger powder in it, and olive oil in it, and I kind of make my bread or crackers in oven, and I have then a piece.
You don't have any problems with the chickpea?
No, I don't. No, I don't.
Okay, so that's your crackers, flours. Okay.
So rather than toast, that's my kind of toast.
You get no distension, bloating, or anything when you have that?
In the morning, no, I don't have that.
Okay.
No.
So that's your morning?
Yeah, that's my morning. That's basically because I can't really bring much variation to it.
What time is that
at? Anywhere between 8 to 10, I would say.
Okay, so you could wake up at 5 and not eat till 10?
I'm not out of bed at 5.
So
I would be out of bed at around
but you're awake.
7.
You're awake.
But yeah, I get out of bed at 5 and I pray, and then I go back, and I lie down, and then I'll maybe come out at 7, and then yes. So in other words, yes, what you're saying is, but today, like, I had my breakfast at 7:30 or 8 o'clock.
Okay, so there are days that you have it within a couple hours, and days where you have it 5 hours.
Yeah. See, now it's changing. So now, because of this, now I have not at 10 o'clock, but you would say like 9 o'clock or 8:30.
Okay. So what's after that?
So then around maybe like 2 to 3, I will have my lunch, which would have pasture raised or organic. It can be chicken. A lot of times it's chicken, or sometimes it can be beef, and I try to have at least organic or grass-fed beef, and it can be steak, or it can be kebabs, and or then fish. A lot of times, like, it's salmon, try to have, like, Jimbo's has coho wild salmon, so I have that. With then vegetables, and I have some, like I said, I always have some rice. So there can be vegetable rice or rice with some chicken in it, or that. And then I always have greens, always spring greens or greens with
Okay.
that.
Okay. That's at 2 to 3.
Yeah.
Okay.
Yeah.
What's the next time?
That's my kind of really main
Big meal.
Yeah.
Big meal is your lunch.
Yeah.
Okay.
Yeah.
And then what's the next time?
And then after that, I have at night very little, very small portion around. I try to have latest by 7 actually, because if I do have any later than that, that gives me problem at night. So it's usually I have the gluten-free bagels maybe, but very thin slice. So if it's like one is like this much, I'll make 4 out of it, and I'll slice it and I will toast it in my air fryer, and then I'll have a little bit of mayonnaise, which is like Elo mayonnaise from Jimbo's, which is like, everything. That's all good, and I'll have some avocado on it.
Okay.
Or just enough that works for me, maybe 1/4 or 1/3 of avocado sliced, and I'll put maybe some. Sometimes I'll get some, let's say from Jimbo's, I'll get some tuna fish salad, salad, which has all the healthy stuff. Their stuff is all clean and works. So I'll have that and small, and that's
it. What time is bedtime?
My bedtime is normally it's 11 o'clock.
11 o'clock. Okay.
Sometimes it's 12. Rarely it's 10. I'm trying to get to 10.
See, but do you get shaky, lightheaded, irritable between your meals?
I used to, but it has improved a lot now. I don't, and I make sure that I eat. Like even when I had to come here, that's my always a thing, that to make sure that I have food with me.
Okay.
So.
And you say you have to eat by 7. And what happens if you eat later? You get distended, bloated, reflux.
I feel reflux. Yeah, at night I do feel that my
you get that burning if you eat.
Yeah, and my throat gets dry. That as if it's.
Okay.
Yeah.
Yeah. All right. So how would you eat more to increase your weight with this?
I don't know. That's the thing.
Well, it's either portion.
I'm doing the best
It's either portion size or more frequent. Or you can have more caloric-rich foods.
Which food?
Higher calorie-based foods.
Yeah, but what are those higher calorie-based foods? That's why when I have veggies in the morning, I have like 5 different types, because one type only doesn't work for me. Because when there is a little bit of lots of things, then my body can take it. But
things like that really increase fat can increase calories. So butter, ghee, more olive oil. Can you do any of those things?
I can do that, but I noticed I love butter. Oh my goodness, I can eat butter so much. But I noticed that when I took, in 2018 or 2019, I increased my butter intake, and maybe that was not normal. That is, I increased that, and I was eating. I don't know. I don't know what it was, but maybe I was eating more beef also. I noticed my cholesterol went up, and then when I decreased those things, the cholesterol went down. So that's why I did mention to you that my cholesterol fluctuates, and I have to.
Yeah, it's up.
Yeah,
but it's not that big of a deal.
No, but I have to really monitor it very closely.
So, all that is basically saying you liked eating butter, but your cholesterol is high, so you stopped.
I noticed that my cholesterol went up, so then I decreased the.
Okay.
Olive oil is not a problem. Olive oil, I've noticed that actually it helps. So olive oil I can take in the morning, like just by itself, and it helps with.
Can you have 2 fried eggs?
I can. I would love to.
Let's do some things like that.
Yeah.
Okay, so for breakfast, let's have you do 2 fried eggs.
Okay.
2 fried eggs. and then and also if you can like double your olive oil.
So how would you?
How much olive oil are you using?
Huh?
How much olive oil are you using?
In my veggies, you
Yeah.
mean? Or I can take olive oil like this also.
Then do that.
So because that helps go to bathroom also.
Perfect. You
Actually.
can take 2 tablespoons.
Every morning.
Yeah.
Not a problem. Then maybe motility activator, I'll have to reduce that. You know?
Figure out what works for
It's
you.
just all.
We need it. Okay. How about ghee? Can you take ghee?
I can take ghee, but watch my cholesterol then. Okay, yeah, I can. I love ghee. I mean, I grew up in that part of the land, you know, where when we were young, we had the land, our home in our village also, and
Would you prefer ghee or would you prefer butter?
butter.
Okay, so experiment with ghee and butter.
Yeah,
We'll monitor your levels. Like,
yeah.
Because when you have thermoregulation issues, being underweight is going to really impact that.
Mm-hmm.
And the other thing too is like when your body fat. Most body fat, if it's too high, it becomes inflammatory, has health problems and other things. But when it's low, body fat actually is a tissue that releases what are called adipokines and protein messengers. It's not just stored calories. So what they found is body fat is actually part of the endocrine system, and body fat creates signaling agents that are really critical for immune function.
Mm-hmm.
Like if you look at your system and how you constantly take vitamin C and supplements like that, it's really hard to have a healthy immune system when you're underweight.
Mm-hmm.
So body fat releases adipokines that are very
What does it release?
adipokines. So adipose tissue.
Adipose tissue.
Adipokine. Kine means protein. So fat cells release their own molecules, just like the endocrine releases thyroid gland releases thyroid hormones. Body fat releases adipokines. And there's over 30 different adipokines. They're discovering more all the time.
Okay.
But it's not just stored calories. Body fat is part of the endocrine system and is a huge part of the immune system. So whenever we see someone who's got like really weak immune system and they're underweight, it's really hard to change that. You can take there's only so much vitamin C and other things you can take. So part of the reason of getting you into more of your normal weight, which is still slender and healthy and fit, is to get you some fried eggs more, some butter, some eggs, and other things to get your body fat up, because your immune system function has to be there. And just randomly worried about your total cholesterol may not be the biggest concern right now, unless you have serious cardiovascular risk factors and we see examination findings and other things that involve. But we can monitor the levels too if you want. Okay, we'll get a baseline of your cholesterol and do a routine blood test we're doing, and then as you increase your fat, you can see if those things change.
Yes,
okay.
that's what.
But you've got to increase your.
I'll happily do it.
Okay.
I mean, like that's what you have seen in my history. I have followed whatever somebody tells me. I have followed happily, but now I am more cognizant because now I have traveled.
So now you have lunch.
Okay.
Let's talk about how you can increase your calories during lunch.
Yeah.
What can you do? So you basically have chicken, beef, and fish.
See, the thing also I've noticed, if I eat more, then I get acidity.
Yeah.
Even though I increase, like rather than taking 2 digestive enzymes, I'll take 3 digestive enzymes.
Okay. So maybe
ginger helps me, but ginger really stimulates my system, and I have to go to the bathroom a lot more.
Can you eat more fatty meats? High-calorie meats?
What are the high? You mean beef?
Yeah.
But then again, cholesterol is my thing.
I know.
So that's as long as I can be monitored for that. Because that is the reason why I have I kind of decreased eating beef also.
You got to get some fat in your lunch.
Yeah.
You don't. I mean, if you're basically using like lean chicken and lean fish and then some veggies, some rice.
Yeah.
Like those are all low calorie foods. Lower calorie foods. You need virtually no fat. The fish will have some good fats, but we still want to get you more calorie rich. Anything else you can do? Can you butter, ghee? You got to do something.
Well, butter ghee I can do. That's not a problem. But butter ghee, I don't think by itself. I think what you're suggesting, and I think it's like those steaks, with like some really good fat.
Yeah. So what's your weight right now?
Because there was a time when I could not eat these things with fat actually, and now it has improved. I don't have that problem.
So what's your weight right now?
I think 93.5 or...
I'll check it again.
See, it varies. It depends on what time of the day. It's basically 89 if I am...
What has been your ideal weight for you?
My ideal would be 105.
Okay. So you're...
I mean, healthy 105.
Healthy 105. Okay.
Yes.
So you're like 10, 12 pounds underweight.
Mm-hmm.
Okay. So we add 10, 12 pounds.
Yeah, I know.
And it's really, honestly, you have to think about it as you got to get your immune system back.
Yeah, I think you're absolutely right.
And part of having to take constant antimicrobials and constantly taking supplements is really because your immune system is weak.
But what do I do for antimicrobial? That's my
You might have to for lifelong. You might have like injury to your nerve plexus and intestinal autoimmunity. We'll see. We have to dig deeper. But right now, there's a lot of health problems associated with it. And,
with taking antimicrobials?
No, being 12 pounds underweight.
Oh, yeah, okay.
Right? And also, when you get to your age group, if you have a serious injury, if you have a stroke, your survivability goes down significantly. And also, if you end up with malignancy or cancer and other things, if you're already underweight, your survival rate goes down. All the things that will take you out in your older age, your risk will dramatically go up when you're underweight.
Oh, yeah.
They've actually found studies when people are even slightly overweight, once they get to 60, 65, they have better survivability of some of those health conditions.
Yeah.
Assuming they're not like severely inflamed or diabetic or something. So, it's part of your health, you know.
Yes, I understand.
Okay. Now, 7 o'clock, you have very little, but it's a good. You have mayonnaise and avocado.
Yeah.
Anything you can do there?
That's only the time when I take avocado. Actually, maybe I can take avocado in. Because whenever I take avocado, if I take more of an avocado, then I have to take, his dow, you know.
So you have to make a conscious effort to gain weight with what you can tolerate. Don't worry about your cholesterol right now.
Okay.
Because we'll have to see, like, as you do that, what happens to your numbers and if that's a factor or something. And you might, here's the thing, you might get to a normal body weight and then not have to eat all those things all the time.
Yeah.
Okay?
Yeah. Okay.
So even if your like LDL is slightly high for 3 months, it's not like that's going to cause you to stroke out or something. Okay?
Okay, yeah. Okay.
But let's just see how you respond to everything, okay? So
and that's another thing, when you're working with functional medicine and then you're working the allopathic doctors, my regular, let's say my insurance and and when they look at and then they write down, oh yeah, she's going through the functional medicine and she's so.
Don't worry about it. You're here now. We're just gonna do a good job. We're gonna be thorough. We're not.
I'm confident, and that's why I'm here, Doctor.
We're absolutely not anti-medicine. I mean, we need everything.
I know you're not. You're not. But then it's a whole array of, Yeah.
We just want to do what works best for physiology. Okay, so we're gonna. What I have right now is we're gonna do some laboratory testing. We're gonna look at autoimmunity, joint autoimmunity, intestinal autoimmunity. Okay, I'll probably want to do a panel through Cyrex called Cyrex Ray 5. It screens for 24 tissue antibodies, and it's screened.
What did you say? What?
There's a panel through a lab called Cyrex.
Oh, okay.
And it's called the Ray number 5. The name of the test, and I'll check antibodies for intestinal autoimmunity. It'll check antibodies for brain. It'll check antibodies for adrenals. It just checks antibodies for all the major tissues in your body.
Oh, okay.
So it's a very good screen.
Okay.
But I also have to do some other specialty antibody markers for joints and connective tissue disease.
Oh, okay.
Okay. We need to do a very good thyroid check, and then on a routine panel, we'll have like a lipid panel and cardiovascular risk markers and things like that. So that's kind of our baseline right now, seeing what's happening. Okay.
You also mentioned something like blood work. There was something with the blood, iron. But in the first...
It was slightly elevated in one of your past tests, but it's not a big deal.
Okay.
But the panel we're doing will have an iron panel there. It'll have like vitamin D, iron, complete blood count, immune cell function.
Oh, okay.
We'll also do your analysis as part of a routine thing. Okay.
Okay.
Is there a budget for labs? Because these will be probably anywhere between 500 to 800, something like that.
No, that's fine. That's okay. I mean, if I need to get done, then I need to
Yeah, it
get
helps.
done.
We need to.
Because I want to get to the bottom of
I
it all.
understand. Yeah, I just want to know. I mean, I have to.
No, I appreciate that.
Because we can also do things in pieces at times, and then the other thing is.
My only thing is that I am working, so I just want to keep everything in a stable way, not something that...
Well, I'll tell you, the biggest cost for you will be your initial lab test, because you're searching for stuff.
Mhm.
You're not going to always have to do all of those things repeatedly over and over and over again. There might be some markers like your lipid panel you can do over and over again, right? But if you just wanted to do a lipid panel by itself, that might be like $40 or $30, or you know what I mean. So it's like we can kind of work through it the best way. We could just have to have the discussion. You just let me know what things you want to get checked, what things you don't want to do, and what things we absolutely need to do, what things we have to like strategize for. Some things are nice to know. Like, it'd be nice to know if you actually have high hydrogen and methane for SIBO, but it's not going to make much of a difference in what we do. So it's like you can think of it that way. Do you want to get into a test for SIBO, or it's not going to matter because you're going to stick to your diet?
No. I mean, if it is not needed, I don't want to.
Right, but that's the point, is when you're
because
saying...
all the arrows are pointing towards it, actually, and...
Yeah. Well, some of it, when you get into the diagnostic part of it, like you're saying, get to the root cause, is like having labs to confirm those things.
Yeah.
But some of those labs may not change your treatment outcomes because you know what works for your body.
Yes.
It's pretty clear at SIBO.
Yes.
Yes. But since your goal is I want to be detective and figure out everything that's there, I have to have the discussion with you.
Yes. Maybe, so like you said, for the beginning, like you want to get these antibody markers, for all these things, because to figure out what's going on in the body, main things.
Okay.
And then you're suggesting that you're saying body weight is very, very important, so you need to do this thing, because other things are secondary, but this is more important.
Yeah.
So
I mean, at this point right now, I really don't want to make any change to your supplements. It seems like it's a very sensitive issue, and you've found things that work for you. There's no point to all of a sudden switch them. Okay. I mean, you're on a lot. You may want to look at reducing some of the things you're taking, especially if you're not noticing a big difference with them. Okay. And then there's probably going to be med change to your diet right now. You're probably going to, you're going to have to follow an autoimmune paleo FODMAP diet. And if you don't, you're going to have symptoms and other issues. The problem is like, why are you having it? What's the depth of it? So most of the diagnostic testing is going to confirm like your prognosis, your condition, why some of these things are there. But I don't see a lot of huge interventional change. We can play around with certain supplements.
But that's good to know, you know. And I had that feeling,
right.
You know. I think it's just I did not find someone so confident saying, okay, let's do this, and this is where you're going now, this is where you are, because nobody shows you any charts or nobody shows you, you know, they just all on the phone or whatever, or just, you know, guesswork kind of, you feel.
Yeah, I understand.
So.
Okay. Is there anything else you think I should know about?
So for antimicrobials, like you said, to have it, but my question was, and my concern has been that if I take it, like I said, like I take it, like Candibactin BR was really good, best, you know.
Yeah.
I take it, for instance, even for 2 weeks, and then I'm off for 2-3 weeks, you know. And then, but I have to get back again for
That's SIBO.
So, but the thing is that what I've heard is that you develop resistance to these things if you keep on taking all the time the same. Is that true? I mean, what do you think? Or
it's a theory of nutrition. No one's ever looked at that with botanicals, and there's some things that just have antimicrobial activity. It's not like an antibiotic.
But resistance, I mean, in terms of
I don't think
research,
so.
is
I don't
there
think so.
you
There is
develop
no
resistance?
research on it. There's no research on it, and no one's ever going to do it because it's going to be a very expensive study, and no one's going to ever look at that. And it actually would be very hard to do. It's guesswork. You got to listen to your body, see what works for you. Now, listen, you have to understand a lot of the SIBO symptoms you have doesn't always have to be from a food you ate. If your immune system gets weaker, you can have more overgrowth. If you get an inflammatory response in your system untriggered by food, like an environmental issue like sinuses or allergies or even lack of sleep, you know, things like that, those can all be factors.
Okay. Okay.
There's one last thing I forgot to talk about, but I want to go over that with you. You seem to be extremely sensitive to stress. Like when you look at your timeline, stress is when you fall apart.
Yes.
Okay, and
Yes.
so when you look at stress, everyone has stress.
Mm-hmm.
Physiologically, you have to have some stress, because if you don't, you have actually depression.
Mm-hmm.
Okay. But there's the concept of you have to have stress adaptation. Like, so that it's not always the stress, because some people have much, much more stress than you, but they have no health problems. And you may have different degrees of stress sensitivity yourself at different times of your lifespan, right? Or even different periods of your life. And that has to do with your ability to be resilient to stress. So the things that impact stress resilient, first of all, will be exercise. Do you get any?
I walk religiously every day for about 2.5 to 3.5 miles.
Okay, that's great.
And now that I started working, so I haven't been going to yoga, but I was doing yoga, like, let's say, once a week.
You're
or
walking
twice a
religiously
week.
every day, pretty much, then, right?
Yeah. My intuition told me 30 years ago that this is going to be my savior. And
Okay.
yes.
What about sleep? Are you sleeping okay?
Yeah, I sleep okay.
How many hours of sleep are you getting?
Now that I started working, I sleep, but I do get 6 hours for sure.
Okay.
But when I was not, I was getting 8 hours comfortably sleeping.
Okay. And then, so sleep, exercise, those are the key things for resilience. The other key thing is going to be community. Do you have people to talk to?
Oh my goodness, I have, yeah. And I have been very involved in my community at a very high level, actually, all my life, basically.
Okay, so that's not an issue. Those are the three main ones that impact stress resilience. The other one could just be you're underweight.
Yeah, and I have touched on it, what caused it, and I know now it's not. Now all those things are not there. Actually, I'm working from home, so.
Okay, so we'll see what happens with your stress resilience as you get to back to your normal body weight.